procedures and precautions that we do in our offices aren't effective against this virus. And one of the big problems that they found is staff was still coming to the offices when they're sick and infecting their patients. A lot of the problem is the reusable equipment. Whether it's just an eyedropper bottle that's used from patient to patient, and they have little protocols. Okay, as long as it doesn't touch the eye, it should be okay. But emphasis on the should. And that's one of the things they're trying to really push for, is to use individual disposable eye drop bottles, so that there's no using from patient to patient, so there's no way to pass the virus. Also, a lot of the equipment is used on the patient and then sterilized, but yet oftentimes that sterilization procedure isn't enough. So we're really pushing for more disposable, single-use pieces of equipment. And sure, it might be just a little bit more expensive, might take a little bit of education, but it's a lot better than going home from the eye doctor with potentially vision-threatening eye infection, and that's a really big deal there. So, one of the things that I love about the American Safe Sight Foundation is what their goals, and what they have this vision, and I love it. That Ali shared it with me. Wouldn't it be great, and I talked about this one outbreak in the NICU, but most of the other outbreaks occurred in ophthalmology, eye clinics, and wouldn't it be great if you could, instead of having to go into the eye doctor and say, oh, do you guys use individual droppers? Do you guys use when you're going to check me for glaucoma, are you going to use the machine that touches my eye, or one of the other ones that don't touch the eye, which is the better one? Instead of having to ask all those questions, wouldn't it be great if there was some sort of seal on the door that you could see on the office, and then that would tell you, okay, that office follows the better disinfection protocols. They use individual use droppers. They use disposable one-use equipment, and they use the proper disinfecting procedures. A lot of offices, including mine, we use the regular rubbing alcohol, 70% rubbing alcohol, to clean various pieces of equipment. But we've learned that this virus isn't killed by that rubbing alcohol. You need to use stronger disinfection procedures, and that's really what you guys are trying to do. And wouldn't it be great to whether you're going into the eye clinic, or my parents or something, and you see that seal, and that would tell you that this office uses the better disinfection protocols, but in order to do that, it takes a lot of education, and that's what the mission of the ASSF is doing, and that's the thing I love. But to do that takes money, right? Which is why you guys are here, and I highly encourage you guys to have another drink and get those checkbooks ready, because I would love it is to, in the near future, to be able to, when I go to my eye doctor and we see the seal on the door, and we know that office, that I'm much less likely to leave that office with an infection, because that is no fun at all to get. So, all right, well, thank you guys, and we got a lot of
All right, hello, good evening, everyone. My name is Dr. Joe Qureshi, and it's my sincere pleasure tonight to introduce Dr. Ron Najafi as one of our guest speakers tonight. Dr. Najafi received his BS and MS degrees in chemistry from the University of San Francisco, and a PhD in organic chemistry from UC Davis. Since then, he's worked widely as both an innovator and a medical scientist and a business leader in the pharmaceutical industry. He eventually founded and is currently leading Nova Bay Pharmaceuticals. Dr. Najafi and his company have been actively involved in the research and development of pharmaceuticals used to combat many diseases, including serious skin, wound, and urinary tract infections. Of most interest to us tonight is Dr. Najafi and Nova Bay Pharmaceuticals' commitment to the eye care healthcare market. This includes developing and marketing one of the first approved drugs for eyelid disease. And within the last few years, this company has developed and participated in clinical trials for drugs for other types of eye infections. This company is also developing innovative products for millions of contact lens wearers. We're pleased to have Dr. Najafi with us tonight, and please give him a warm welcome as he comes to the stage.
Thank you so much. Thank you, Neely, and for organizing this event. My original name, for those of you who are from Iran, I'm Ramin Najafi. I go by Ron. Originally from Iran, I came to the United States when I was 18, and my dad had a pharmaceutical company. I was always interested in pharmaceuticals. I did pharmaceutical sales for him. I came here 2 years before Revolution, and then unfortunately Revolution happened and I got stuck here. I had no intention of going to get a PhD in chemistry. I wanted to get a bachelor's degree and go back to Iran and help my dad run his company, and ended up becoming a professional student, and just because of the visa, F1 visa, so I got overeducated, and I said, my dad always jokes, he says, the only good thing that came from Khomeini's revolution was you got overeducated. But anyways, I've been always very entrepreneurial. I love sales and pharmaceutical business, but I ended up with a PhD in chemistry and I had to do something with it. I worked a number of years for pharmaceutical industry, Sanofi Aventis in Philadelphia, and eventually I founded my own company, Nova Bay. I'm the founder of Nova Bay. Nova Bay is a publicly traded company listed on New York Stock Exchange. I took the company public. I raised about $140 million so far in Nova Bay. And we managed to do the largest clinical trial in EKC ever. Alcon didn't do it, Bausch and Lomb didn't do it, we did it. And I'm really proud of the work we did. We actually, I think through our website, Neely contacted us. It's a website called bayinnovation.com. We're very passionate about EKC infection. And my sister is an ophthalmologist. I think that's because of her passion and her telling us this is a dreaded disease that I felt it's important to devote a good $10 million to this clinical trial. And I want to tell you a little bit about this disease. I think our previous speaker talked about it. It's a miserable infection. Adenovirus is a double-stranded DNA. It's very tough. If it sits on this surface, it could sit there for 5 to 10 days without anything happening to it. It could still transmit into a disease. There are multiple adenoviruses. You could have an adenovirus that causes diarrhea, lung infection. The type that causes, there's 3 serotypes that cause this dreaded EKC disease that manifests itself in the eyes. And the eye becomes red, it becomes gritty feeling, you have a foreign body sensation like you got sand in your eyes. It has some matting, you know, your eyelids stick together. It has mucus discharge, and it could, as our previous speaker mentioned, it could last weeks, months, or years. And the problem, depending on where some of the subepithelial infiltrate happens, you could end up having serious blurred vision. In the United States, it moves like a storm. It came to Chicago and hit a bunch of people, and then it went to, it just moves like a storm. It's been epidemic keratoconjunctivitis in Vietnam. It was an epidemic in some, hospitals. So it just moves very quickly. It's very contagious. And, people ask me and say, what is the best thing we could do to prevent for this disease? I said, prevention, number one. You don't want to get this disease to begin with. So you want to have technology that could prevent transmission from, say, tonometer. You're measuring eye pressure, you go to ophthalmologist, and you want to make sure you don't get it from that device. Education, prevention and education go hand in hand. The second thing is a vaccine. There was a vaccine, several years ago. US government actually was paying for it, and now they stopped and there's no vaccine. The vaccine is the next best thing. And the last is intervention. Once you have the disease, it's really hard to get rid of it. It becomes systemic. It becomes part of your sinuses, lung, and it's really hard to then prevent it. So what do you do when you have an epidemic keratoconjunctivitis? You go to your doctor, you pay your $25 copay or $50 copay. You go see a doctor, and the doctor says, sorry, there's nothing I can do for you. That's what they should say. There's absolutely nothing I can do for you. But because the copay has already been paid and doctor feels like you've got to do something, doctor gives them an antibiotic. Wrong thing to do, because now you're developing antibiotic resistance and the problem of antibiotics. The other thing that a doctor does, they might give steroid. Again, a terrible thing to do. Because steroid now lowers your immune system, and now your fight with the viruses effectively is dampened, and the virus becomes even more active. It does make the patient feel better, but it doesn't do anything for the disease. So the combination of antibiotics, steroid, is what most doctors do. Unfortunately, the disease, it needs a lot of work. It needs a lot of education. We are very connected to an ophthalmology world. My company, we have about 45 medical reps. One of them is here, very Stuart. So Stuart Whedon is our Southern California rep. He knows most of the ophthalmologists in Southern California, and I suggested to Neely that perhaps at the next year conference, the next year Gala event, we would invite more ophthalmologists. But I think more importantly, your message needs to get to the American Academy of Ophthalmology, which was actually happened last week in Las Vegas, where we attended. There were thousands and thousands of ophthalmologists, and this message, your seal, your concern should get into their head. And unfortunately, there were no discussions there. I actually looked for it. There was nothing on viral conjunctivitis, epidemic keratoconjunctivitis. So I'm glad that you're championing this cause, Neely. It's really important, and I'm happy to be part of it. The company NovoBay is focused on developing non-antibiotic antimicrobials. These are based on the chemistry of white blood cell, which I developed a number of years ago, 20 years ago. Our product, our drug is now on the market as of last year, and It's called Avenova. It has very, very good anti-EKC activity in vitro. It can potentially be used on tonometer and other instruments that ophthalmologists can use. Avenova is, for those of you who are in ophthalmology, hopefully you've heard about it. It's a non-antibiotic antimicrobial for the use in blepharitis, which is a very common eyelid infection and inflammation, which right now there's no treatment for. Again, doctors use antibiotics, and chronic antibiotic use is not recommended, and you end up developing drug-resistant bacteria. Every time our product is used successfully, less antibiotics are used, and of course we have anti-EKC activity that can potentially be useful for some patients. I'm happy to be here, and I'm really glad that you've invited me to tell you my story. Please take a look at theinnovation.com.